start. I am Dr. Naveed Aziz. I'm in Cumberland County. And the reason why I am part of this is because I am really very passionate about my patients. I run a free clinic in my office every Thursday afternoon, especially for patients with diabetes. And I can tell you stories after stories is how our own people here in America, it's so sad, the richest country in the world is treating patients. And I thought that, I will have to come up and educate people that how healthcare system is so messed up in our country and what we need as all of us to stand up and say enough is enough. So today, Lori and I will be talking about healthcare system in general, and particularly I will talk about also how women and children will be affected.
I'm Lori Heim. I'm a family physician. I work as a hospitalist now. I got involved with the AHCA when I was president of the American Academy of Family Physicians, and we were heavily involved with trying to get the bill through Congress. The big moment for me was I actually got to meet Obama in the Oval Office as a result of all that work. To now be back trying to defend it is just heartbreaking. I really didn't think that they would have such a horrible plan in addition. So I want to take you through some of the specifics of how it will affect, and more importantly, to finish with an ask for everybody. Once you understand what they're proposing, we need to be very concise when we go to talk with other people and talk with Congress about what they need to make sure that they preserve. Because the Senate now is going to be coming up with their own plan, which will have to go back to the House. And in the Senate, we may have an opportunity still to stop it. So, go ahead.
Okay, so can everyone hear me okay? So our healthcare system is actually it's standing on 4 feet. So if you will think of it like a table with 4 legs. So we have one leg as patients. Number 2 is providers. Insurance companies like to call us providers. I dislike the term. I call myself healthcare professional. But regardless, healthcare professionals, which would be physicians, nurse practitioners, nurses, hospitals, so on and so forth. The third leg is insurance companies, and the 4th leg is the pharmaceutical companies. So in order for this table to be standing on 4 feet, all these 4 feet have to be taking some responsibility and have to do something. So out of that one leg, which is the pharmaceutical companies, they have the biggest, deepest pockets and are the strongest. So when President Bush signed into law Medicare Part D, that is prescription drug benefits for Medicare patients, at the time, the Republicans were in control. So they also wrote into law that Medicare will not negotiate prices with pharmaceutical companies. Doesn't it look odd, right? So that makes our country the only country where pharmaceutical companies set up their own prices, and they can be several thousand% of profit margins. Not only that, the medications which are produced in our country, when they go to another country like Canada, England, Australia, etc., those countries will negotiate prices with these pharmaceutical companies and will be able to give those medications at cheaper rate. And when we want to import those medications back to our country, where it was produced originally, no, it's very unsafe. We cannot bring them back. So have you ever seen a Canadian die of unsafe medication? But I have seen a lot of patients die in our country because of lack of medications. because they cannot afford medications, die of simple problems like diabetes, hypertension, and high cholesterol because of their complications, because they were not taken care of at the right time. Okay. So when President Obama came this time, the Democrats were in power. So we thought that we are going to get some benefits, right? Pharmaceutical companies would be able to do something. Well, few things we got and few things we couldn't. Pharmaceutical companies, especially the ones which sold brand medications, they were imposed on some, taxes were imposed on them. Similarly, they were also able to help the patients with donut hole. Everyone knows what donut hole is? Okay, so we spend so much money and then we reach the hole and then you have to spend out of your pocket and then you go to the next level. So the pharmaceutical companies were the first people to come up and again negotiate and said, oh, you know what, we are going to spend some money, we'll give you some money so that patients can take some of it and use it for their donut hole. But please don't ask us to negotiate prices with the Medicare. And of course they got what they wanted. They did spend some money to help with the donut hole, but they increased the prices. Now they're making the same profit or maybe even more because they increased the prices. So, and also we will not be able to import medications. So when Trump came, everybody thought, oh, you know, especially the Mr. Trump's supporters had thought that he is going to negotiate prices and he is going to bring the prices down. So what did he do? Now the taxes which were on brand name medications, those pharmaceutical companies which produce branded medications, their taxes are going away according to the new AHCA. The second thing, according to the fair trade deal, those pharmaceutical companies which are selling medications out of the country will also not be, those governments will also not be able to negotiate prices. We need to get fair trade, right? So we are going to sell medications at a higher rate even to the countries which normally were able to spend less money for their own patients. So, and also we are not going to negotiate prices again. So this is what the pharmaceutical companies is. So they are always going to get the benefit, and the price tag which everyone has to pay for medications, which everyone knows can be so expensive, is out of control. Now this table with 4 legs is converted into a stool with 3 legs. And these 3 legs really have to balance each other very accurately, otherwise it's going to crumble. And these 3 legs are patients, insurance companies, and providers or the healthcare professionals. So when Affordable Care Act was being written, even though it was supposed to be Medicare for all, or there should have been some public options, but then apparently we had to reach across the aisle and we had to do whatever other people were also trying to tell us. So there was a compromise bill came up, and the compromise bill, but still it was a good bill. The thing was that some people will get benefit, other people will also get benefit, but some will get more benefit and others will get less benefit. But in general, overall, the society is going to benefit. That is what the main aim was. So in ACA, what happened was that for patients, for example, what would happen for patients? So patients at 100% of poverty would get Medicaid. Between 100 to 138% of poverty, Medicaid was supposed to be expanded. From 138 to 400% of poverty, you could get affordable health care through exchanges. And premium would be paid by subsidies. And from 100 to 250%, from 138 to 250% of poverty, your co-pays and co-insurances cost from out-of-pocket cost was also to be subsidized. Okay, so What is the poverty level? For one particular person, one individual, it is $11,880 per year. So you can multiply it with 1.38 to get 138%. And multiply it by 4, so it would be $47,520 at 400% poverty level. So anyone who was making up to $47,000 was able to get affordable care, and the premiums were subsidized. Now, for example, a patient who was making $36,000 was able to bring home $3,000 per month, and after taxes, let us say he was able to bring $2,400 home, and his premium was, let us say, $700. He has already paid $600 in taxes because he was able to bring only $2,400 home per month. Out of those $600, the government was able to subsidize the premium. So the government would give $600 to the insurance companies, and the individual would give $100 to the insurance companies. And that is how they were able to afford this health care. You understand? So this is how this Affordable Care Act was supposed to come. Now, between 100 to 138%, Medicaid was to be expanded, and our state refused to expand that. Where was that money going to come from? Federal government was subsidizing the hospitals. So if you have diabetes, hypertension, high cholesterol, any other major problem, and you do not have a doctor, and you have never seen a doctor, and one day you crash because of a massive heart attack or a stroke, and you end up in the hospital, an emergency room, then the hospital has to take care of you. So the hospitals were subsidized by federal government. So federal government took those subsidies away from the hospitals and then gave it to the states so that they could expand Medicaid. So what happened to our state? Our state, the hospitals lost the subsidies and patients did not get Medicaid expansion. So our tax money went to Kentucky and all the other states which expanded Medicaid, and there were about 500,000 patients in our state which were not able to get Medicaid expansion. So this is how this happened to 100 to 138. And Medicaid was always there. So federal government also subsidizes the states with Medicaid. So, and there's a different formula for different states. For our state, it is 67.7%. So if our state is spending $1, federal government pays 70 cents to take care of the patients on Medicaid. So it was subsidizing each individual patient who was receiving Medicaid benefit. That was an Affordable Care Act, and it was always there. So now, what benefits are we going to get? The insurance companies were mandated to do certain things. There could not be junk insurance companies anymore. They had to do certain things. And one was that if you were 26 years of age or younger, you could be on your parents' plan. So with all this recession, so many of college graduates came out without any jobs. It was really beneficial for those people because they could still be on their parents' insurance for quite some time. The second thing which was most important was the pre-existing condition. So there was no pre-existing condition. So if you had diabetes, hypertension, high cholesterol, any other problem, and you wanted to go and get insurance, insurance companies would not only give you insurance, but would give you at the same rate as they would give it to any other person who had insurance previously. The third thing was that no lifetime benefits cap. So before that, sometimes when kids were born with disabilities, or kids were born with problems, and they were in NICU, in the first few months of their life, they actually maxed out their lifetime benefits. So now with the Affordable Care Act, it was that there is no lifetime benefit, no cap. So you will get that. Then there is no gender gap. At one time, women were charged more premium compared to men. And now women would be getting the same coverage at the same premium as men were getting. And there would be no elderly gap, except that insurance companies can charge not more than 3 times to their elderly and sick patients compared to the younger patients, not more than 3 times. That is what Affordable Care Act said. And then they were supposed to cover essential health services. Essential health services included emergency care and also covered the prescription medications. So there wouldn't be any insurance company which will not cover emergency care, and also there won't be any insurance companies which does not cover prescription medications. In addition to that, women and children got a little bit more benefits. For example, women were supposed to get family planning, contraceptive, a federally FDA approved contraceptive. All the contraceptives were supposed to be given for free. And women save $1.8 billion in a year only on contraceptive medications alone. And then it would cover maternity care. Now, obviously, you know, a man doesn't have to go through maternity, right? And a woman has to go through maternity, and insurance is not given to a woman, and there's no prenatal care. Unfortunately, it is a big problem. So maternity care was also mandated to the insurance companies. Then lactation support. So women who were able to work and also wanted to give breastfeeding to their kids, they were able to get the breast pumps and things like that, and were able to store their milk and still able to breastfeed their kids. And all the preventive care services like mammograms, pap smears, they were supposed to be given at no co-payment, no out-of-pocket cost. Smoking, quitting to smoke, obesity, as well as mental health services and domestic abuse counseling. That was also to be given by the insurance companies under Affordable Care Act. Sexually transmitted diseases, HIV, that was also supposed to be given under Affordable Care Act by all the insurance companies. Abortion was never part of Affordable Care Act. It was that you can have at least there should be one insurance which is providing abortion services, but there will be no subsidies given for that insurance company. So abortion was not part of Affordable Care Act, even because people don't realize there was a Hyde Amendment after Roe versus Wade 1 year later. Not even Medicaid covered abortion. Federal government never paid subsidies for abortion. And abortion was never part of Affordable Care Act, even under Obamacare. And then for children, there was another program which came up, which was called CHIP, C-H-I-P. So even for those states like our states which did not expand Medicaid, so kids between the poverty of 100 to 138 were still able to get some benefits under the CHIP program. And there were some benefits which the children were supposed to get, and that was the vision care and the dental care. So all the kids, their insurance plans had to give them vision and dental care. Then autism screening was part of that. Mental health, substance abuse, that was also part of Affordable Care Act mandate to the insurance companies. And overweight, obesity, that was also part of that. And vaccination. The insurance companies were supposed to give vaccination to each child, and that was supposed to be covered. And for elderly, of course, that it was, you could not charge more than 3 times to what you charged the younger population. And Medicaid was also to be provided to elderly patients for the long-term care. in the nursing homes and long-term care at home, Medicaid was supposed to be given to those patients. And what would insurance companies, now insurance companies have to do all that, right? So what are they going to get? They're not going to do anything without getting some benefit out of it, right? So what benefit are they going to get? What they will get is that every individual will have insurance, regardless of whether you're sick or you're not sick. So insurance companies thought that younger population will come, of course, patients, younger people were in the pool now. Those who are not sick, they have to come. And if you are not taking health insurance, there was a penalty for that. And the penalty was $650 per year, or 2.5%, $685 per year, or 2.5% of your gross income, whichever was greater. So that was the individual mandate that every human being or everybody here in the United States has to get insurance, okay? So that is what insurance companies were getting out of that. Now what about providers? For providers or the healthcare professions, it depended on whether you are a solo practitioner or you're part of a big group, because there was electronic medical record, meaningful use. You have to spend maybe sometimes hundreds of thousands of dollars on maintaining health records. Also, you have to be probably be paid a lump sum, not individually, and things like that. Many of the solo practitioners have now started joining the big corporations, hospitals, and so on and so forth. I think pretty soon in Cumberland County, I would be the last woman standing solo. Pretty soon. But I don't mind that. I feel that if the patients are getting good benefit, somebody has to sacrifice. We are our brother's keepers, right?
Actually, most of your suffering was not part of AHCA. It actually came about because of regulations that were separate from that. So your suffering, I get that, but it wasn't right. AHCA that did it.
Right, but it was during that time period. Anyways, but that's all right. So that is how Affordable Care Act was supposed to come. Now, when Mr. Trump came in, he wants to repeal Obamacare. Not only Mr. Trump, but the Republicans repealed it more than 40 times during the last few years, and they were not able to repeal it at that time. So they cannot really repeal it as such, because the Senate, for example, you have to have 60 votes in order to repeal it, and they don't have that kind of vote. So they are going through a process which is called budget reconciliation. So we are going to dry out, we won't fund you. And when we won't fund you, then we can say, oh, it's broken. And now we are going to bring in our own plan. So their mode of action is to break it and then cry that it is broken, and then bring their own plan and say, well, this is what the best we can give you. So now they come up, they say that they will still have mandate of pre-existing conditions, but one pre-existing condition is different from the other pre-existing condition. For example, today I don't have insurance, or today I lose my health insurance because I lose my job. I have diabetes, hypertension, or any other problem. If I fall into 100 to 138% of poverty level and my state has not expanded Medicaid, I will have to pay no penalty. After that, I will pay $685 penalty per year, or 2.5% of my income. But even 2 years down the road or 3 years down the road, if I want to get an insurance, the insurance company has to give me insurance. Not only give me insurance, but also give me at the same rate as it is being given to other people. But with Trump Care, pre-existing condition is that if I lose my job today and I don't get a job maybe 1 year late, till 1 year later, or even if I get a job tomorrow, but my new job does not give me insurance for 6 months down the road, and I lapse my insurance for 63 days, the insurance company is able to charge me 30% more for 1 year. Does it look like pre-existing condition equal to the pre-existing condition? No, right? Then they come up with this bright idea that we don't want to give you subsidies, we will give you tax credits. And they're trying to tell everyone that tax credits are much better than subsidies are. And let me explain it to you what tax credits are, okay? So the same person who I'm talking about for $36,000, a person who earns $36,000, he brings home $3,000. So now he has to pay $700 out of his pocket in order to get health insurance. And if he is not able to pay $700 out of his pocket, he will not get tax credit at the end of this year because he never got the insurance. Whereas according to them, according to Trump Care, $75,000 up to $75,000 income, you can get tax credits for a single person. And it goes all the way up to $115,000. So a person who has $75,000, who brings home $6,000 per month, he will be able to afford $700 per month. So he will be able to get the subsidies, the tax credits at the end of the year. Right? So, then the tax subsidies and tax credits are not the same again. So you understand what I'm trying to say? So they are trying to give tax credits to those who already don't need the tax credits. They are going to giving tax breaks to all those people who already don't need tax breaks. And those people who need them, they are the ones who are going to suffer.
And it's going to be age-based. So right now it's actually more, it's income-based. But with the change with the Trump Care, it will change so that if you're 50 to 59, you will get a certain tax credit of $3,500 a year per person. If you are 60 plus, because this is a decrease from what it is now, if you're 60 plus, you'll get $4,000. So that's, you can find a health insurance plan, I'm sure, for $333 a month. So right now in this country, the average person in their 50s and 60s is making about $2,700. What that works out to is, in 10 years from now, when this all, if it takes effect, that person, so if you're 54 right now, in 10 years, you would be paying $26,500 a year. Oh no, earning, if you make $26,500, which is the median for this country, you would pay $1,700 under the ACA. Under the AHCA, that price goes up to $14,600. Now remember, this is somebody who is making $26,000 plus. That is over 858% increase. And they call that equity. I call that disparity. And that's why the AARP has come out against it in particular, because of the increase in prices for the elderly.
Right. So actually, originally they said that it is only going to be age related, but they also came up ultimately with a formula with this, the House which passed the bill was there's going to be a phasing out. And phasing out is $75,000 to $90,000 for an individual, $115,000 for single who is 60 years or older, $150,000 to $190,000 for up to 29 years of age. So if you are up to 29 years of age and you are a couple and you make $150,000 to $190,000, even then you will get the tax credit. And if you are a couple, no, actually single, and if you are a couple and you make $230,000 a year, even then you're going to get the tax credit. And if both of your spouses are more than 60 years old, then if you make $290,000, even then you get the tax credit. So who do you think is going to get the tax credit? These people who are able to pay upfront their health insurance. And those who are not able to pay upfront, they will not have health insurance. And if they don't have health insurance, then later on also, if they're able to afford it, they will be penalized 30% more. And then the funniest thing which I like about this, which I dislike about this, is that states, there will be no Medicaid given per person. It would be a lump sum, and it is $8 billion, right? It's $8 billion for 5 years. So right now, it is 70 cents to $1, which is given.
The states would be able to opt for 2 ways of doing it. They could go to a Medicaid that is a per capita, which is capped at $2,016, which will be inadequate. Or the states can opt for a block grant, which will also be inadequate.
Which will also be inadequate.
Yes.
And then the states can also make their own definition of essential health care. So the states can say, well, you know, children vision is not essential health care, just like they said that a contraceptive is not essential health care. Tomorrow they can come and say dental care is not essential, or they can say, oh, vaccination, oh my God, that gives autism, right? So
Let me go through some of the things that I think are the asks when we go back about this bill. Because you've covered where we're at right now with the ACA and what they're going to do to us. So in the big sort of buckets is they've taken away, they've changed the subsidies, they've increased the cost for the elderly. The essential health benefits is really important to understand because there were 10 things that were considered essential health benefits. And what that meant was that you couldn't buy a crappy health insurance because before ACA, just like you can go out and you can get car insurance that really doesn't cover you. Well, before the ACA, you could go out and a lot of people ended up buying health care that they thought was a good insurance and they were paying a fair amount of dollars. What they found out was when they went to the doctor, it didn't cover anything. When they went to the hospital, it didn't cover anything. If they got pregnant, on and on. So part of the ACA that I think was the most beneficial was to say, listen, if you're going to have a plan in the public marketplace, these things have to be covered, like you've talked about. Hospitalization, all the maternity, all the women's care issues, and you can't have COVID. That was incredibly important. Now, the Republican bill, it says in there that you still have to have essential benefits, and they say that they have not changed it. And if you look at what Hudson says, that's exactly what he's lying about. The problem is they have these huge loopholes that you alluded to. What it says is states cannot change the essential health benefits unless you ask for a waiver. So, California might not ask for a waiver. What do you think is going to happen with a Republican-held North Carolina? You can sure as hell bet they're going to ask for a waiver. And with the current government, they're going to get a waiver. Now, once they ask for a waiver, then all bets are off. Then pre-existing goes away because the pre-existing is only if you don't get that waiver. So all the things that the AHCA supposedly still protects go away. And that's why if you look at places like PolitiFact, they looked at this because Trump came out and said, oh no, I've still got all this stuff I promised you on the campaign. And they went through and they found all these incredible loopholes through the entire bill, and they came out and said, false. So those are the things when we go back and say, if you're going to do it and you're going to claim that you have these protections, then you have to get rid of the state's ability to ask for a waiver because it makes it meaningless. And that includes your age rating, and it includes your essential health benefits, your annual and lifetime benefits. And let me tell you, if you have one heart attack, my husband alone would have outdone his yearly, and his wasn't even that bad. Sorry. It's real. And then what happens is after that, you pay out of pocket. And that's why before insurance, well, actually before the housing, what was the #1 cause of bankruptcy? Healthcare. Exactly. So that's what we're going back to, because these annual and lifetime benefits are going to go right back in there. And then you talked about Medicaid. And the other thing that is absolutely false and very real, and that is the high-risk pools is the other way that they want to do this. So they say, okay, you get sick, I get breast cancer, then the state has the waiver, so that means we can't get insurance. But the law says, well, if that happens, don't worry, because your state has to have basically a high-risk pool. So all of us who are sick, let's all go over here. Money that they have allocated to that high-risk pool, which will be divided across all the states, everybody who's in the insurance agent industry has said is not nearly enough. So they're going to have to parse who gets what. Now, do I get my breast cancer treatment, or do you get yours? You know? Those are the decisions that are going to be made.
Real.
It is real. This is what happened in this state before the AHCA. This is exactly what happened. I had patients, they could not afford to get the high-risk insurance because it was $4,000 and they couldn't afford it. That's what we're up against again. So that is another incredibly important thing. And these block grants that they're talking about coming to the states, they are going to be inadequate. So again, they're going to cut the eligibility because the states still will have the opportunity to decide who is eligible for Medicaid and what services will be covered. So there'll be more wait lists for Medicaid. They can also cut the reimbursement to the healthcare professionals. So that means that there's going to be less access, because if you're a healthcare professional and you are not getting paid what it costs you to deliver the service, you're not going to stay in business. And so you literally end up shrinking your Medicaid population that you could serve. So that's what's going to happen on your Medicaid when they start going to these grants. The current problem that we face in North Carolina, the biggest thing is we have a lack of competition. There's one company still standing. The rest of them pulled out. And there are a lot of reasons for that. One of them right now is also the uncertainty, because they're having to project and go to the state insurance regulator now to tell them what they're going to charge in 2018. And they don't know. They don't know what the rules are going to be, you know. So they're actually jacking up their rates in a lot of cases, because if the individual mandate goes away, like you said, they're going to be left with a bunch of old, sick people, and we're expensive.
And we need a lot of money for salaries of our CEOs.
Oh yeah. So what can they do? Well, here's another ask. If you really want to increase competition in all states, it's not by across state, being able to buy insurance across state lines. Because you heard about that, right? That was going to be one of the big things they were going to do. Is it in the AHCA? No. Not even addressed, right? You get a gold star. Not even addressed. So what they can do, however, is one of two things. one that can go back, and the state insurance regulators could require that if you have any plan in the private or group markets, you have to then participate in the public market. They could do that. We could do that. Our state could do that too. The other thing that makes even more sense is to come back and say, okay, you have to include a public option.
Yes.
If they did that one thing, then this issue, that and the individual mandate, then we would have competition. And with that, I think, are we out of time?
Yeah.
Yeah.
Thank you.